I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Hello and welcome to this episode of IDD Health Matters. We have a great guest for you today. It's Dr. Kelly Nye Lingerman. Welcome, Kelly.
Hi, Craig. It's wonderful to be with you today.
So, Kelly, talk about what you do in this field.
I'm really excited to share a little bit about what brought us together today. But in sharing a bit about my background, I'm a social worker by training. I currently work at the University of New Hampshire's Institute on Disability, where I serve as the director. And the Institute on Disability is New Hampshire's designated UCED, so UCEDD, University Center for Excellence in Developmental Disabilities.
I'm glad you explained that.
Yes. Our field is full of alphabet soup acronyms. So I've been with the Institute on Disability for 4 years, and in this role, I guide and lead the portfolio of work that we do related to health, disability work across the lifespan of disability and across the experiences of disability. So our work really is focused on increasing inclusion and belonging, advancing participation, and driving information, data, and education that improves the quality of life of people with all disabilities.
So, Kelly, what are some of the things that you do to achieve those goals?
Yes, we talk about these things in sort of big, broad terms, but how we met today and what brings us together is we're actually here as part of the START National Training Institute, which is an institute focused on improving the quality of life and experiences for people who experience intellectual disability and mental health. So one of the areas of expertise that we have at the IOD is intellectual disability and mental health, or IDD-MH. And the conference that we're here at today is really around improving and advancing practices that allow professionals to support individuals and families in the most inclusive, equitable, and community-based way possible. But in addition to that, this year's event has also been very rich with people with lived experience and other community partners. So you didn't necessarily have to be a START program or connected directly to START to join us at SNIDI this year. And that's really enriched, I think, the learning that we've had at this particular event. But START and the National Center for START Services is just one of the sort of projects and programs at the Institute on Disability.
You know, one of the connections I think that we have and that I have to this program is something that I talk about a lot, that there are so many signs of underlying medical conditions that often present as behavioral challenges in people. And many times those might be misinterpreted as either that's just what the person does. We call that diagnostic overshadowing. We've talked about that here before. Or maybe some mental health condition, and people may jump right to the mental health condition and forget about looking at the underlying medical conditions. And that is something I think is so important that people recognize, and I know people here do because I've heard them talk about it, and I love that. But it's so important to recognize how many underlying medical conditions can present as behavioral challenges, and they're treatable and they're fixable. And when we do that evaluation and we recognize those things, we're preventing unnecessary suffering. We're preventing the potential for life-shortening events that could occur that occur from that, and I think that is so valuable and so important.
I think that you bring up a critical crux of an issue in our field is that, you know, many of the people here that we might work with day to day really care and understand and are driven to really see the person's whole person health, and that's not a new thing. But I think if you look at, you know, media and news and all sorts of things, we're talking about whole person health. It's our physical health, it's our mental health. It's our emotional and spiritual health. But for so many generations, we have really excluded people with intellectual and developmental disabilities from that conversation in a meaningful way. And so to your point of when somebody presents with, you know, a challenge, an issue, a complication, we almost sort of go to what is easiest to sort of tamp it down rather than understanding the root cause. And so I do think it's a piece of really inequity in in healthcare for people with IDD, because many medical industries, many mental health industries aren't necessarily fully trained or fully comfortable supporting the population of people with intellectual and developmental disabilities. But I think I would make a venture to guess that many of the groups and the people that we care about, that's what they've designed their careers on, to say, I might be a nurse, but I also have an area of specialty in IDD or autism, or I may be an occupational therapist, or I may be working in, working as a social worker, and really saying that while people with intellectual and developmental disabilities are a unique population, many of the same things that we use and deploy in health and wellness can absolutely be applied.
You touched on the education piece, and that's the other big piece for me is it is so important that all programs, training programs, health professional training programs, or any training program be inclusive of training about how to provide good health care, good supports and services for people with intellectual and developmental disabilities. And we're not there yet. We've got a lot of work to do, but it's really encouraging to hear what I've heard here at this conference and the understanding of the need to do that. And the other thing I'll say is that I've seen some movement in the past 3 years or so, more so than I have in my whole career, about people recognizing the health inequities for people with disabilities and the need to provide training and education. So that's really encouraging, and that's really exciting.
Well, one of the central focuses of SNIDI is, again, bringing people together around education, which is exciting. But going back to your first question about sort of who I am and where do I come from, I worked in a university setting for over 15 years now. And I think for me personally, that's also one of the really driving and motivating factors, is that being part of a university and educational community, it's also at the heart of what we do. Mm-hmm. We just happen to specialize teaching and training and education research on disability, but that being part of a higher education community is really so important, because that is where you're touching those pre-service individuals before they finish their nursing degree or before they go into, to law school or med school. And to not underestimate the power and the value of higher education as a really essential tool. On that note, thinking about equity in general, I think one of the other challenges and opportunities that we navigate day to day is how do we also make inclusive higher education accessible and available to people with intellectual and developmental disabilities, because education is also a key stepping stone to so many other pieces. So,
and I've seen growth in that area too. There are many more higher education entities that are starting programs or have programs to include people with intellectual and developmental disabilities in their student body, I guess.
Yeah. We actually have an inclusive higher ed program at the University of New Hampshire. It's called UNH for You, and where there are students who are students like everyone else. They happen to have intellectual disabilities, but they live on campus. They attend all of the regular classes, are part of the UNH campus community. And that's been really it's been a really profound change in so many different ways, because I think, as I was just talking about education being transformative, one of the things that we've also seen really be transformative about that experience is having shared community space. And some of the greatest growth and the greatest impact, both on students who are experiencing intellectual disability, but also on the people and the professionals and the other students around, is when you share physical space, when you live together, when you work together, when you study together, it does change who we are. And I think some of the greatest jumps we've made in our inclusive practices and inclusive thinking, particularly in this program, is that community connection. And so I think, again, we sort of talk about community in a very abstract way. Sometimes it was actually part of some of my opening comments for the event this week. But you really can't underestimate the power of having shared physical space and also having that shared emotional connection through sort of community building interpersonally.
That makes perfect sense. So one of the other reasons I do this podcast is for people to recognize this as a field where they can have a very rewarding career. Mm-hmm. So how did you get into this line of work?
I'm so glad that you asked, because as I mentioned, I'm a social worker by training, and my background came in direct practice. So I started working in residential programs when I was a young adult prior to going to college. And while my family had some connections to the disability field professionally, it at least was sort of on my radar of like, this is a space I'm comfortable in. But I worked in ICF facilities. I worked in community-based group homes. And in college, I actually worked at our day and employment service provider in Iowa, which is where I went to college. And really what it did was it fully set my trajectory to say this was a community that I wanted to be a part of. This was a community I cared about, and a community that was I would say, deep in dire need of allies and professionals to partner with to advance health, wellness, equity, inclusion, all of those things. So I spent many years doing direct practice, which I think about almost every week in my job.
Yeah.
But I went on, got a social work degree, and worked in some professional roles. I ran a day and employment program. I worked as a professional guardian, a court-appointed professional guardian for a number of years. But I found my way into the university setting. And I did that mostly because I was frustrated and angry, because so many of the lives that people wanted to lead, policy and systems got in the way, whether it was rules about Social Security, whether it was rules about how late you could be out from your group home, whether it was rules about, what your parents thought you should be doing. People couldn't be their best selves or be who they wanted to be because of sort of all these other restrictions. So went on, got a master's degree in social work, worked at the University of Minnesota for 11 years and had wonderful project and research experiences there, but I still got frustrated. And so I did go on to get my PhD in social work with a focus on research, particularly in those public programs and services that really, it sounds overly dramatic to say make or break someone's experiences, but Social Security programs can make or break people's economic well-being.
Sure.
Pathways to employment can make or break people's economic well-being. And so spent a lot of time working in the research space related to vocational rehab, Medicaid, home and community-based services, and supplemental security income and Social Security disability insurance. So lots of big words and acronyms, but I feel like for me, my pathway continues to sort of drive me to this space to say you can have both, and you can have a robust and fulfilling career in research and policy and still maintain a deep connection to the communities that we care about. And if you actually ever, for me, if you ever sort of break that line, you maybe lose the impact or lose the credibility, because I'm constantly learning, especially at events like this, to say, what is the next thing? Like, what is the policy angle that we need to take? What is the advocacy that needs to happen? What do we need to bring back to undergraduate students at a university to change the world? And it sounds overly dramatic, and I don't mean it to be, but it really, for me, that's really been kind of the song of my career.
Well, I love the way you think, and I love your passion. Mm-hmm. So what's next for Dr. Kelly?
I think where I have actually found my greatest amount of joy right now and purpose in the moment is actually being sort of a leader and administrator. It does not sound glamorous, and I assure you it's not. But when I see the number of talented professionals that I work with at the Institute on Disability, and then I have the pleasure of working with at UNH and all over the country, having leaders and having people champion your cause to sort of clear the way to say, I don't have to be an expert in IDDMH. I don't have to be an expert in nursing or, a certain research strategy. But if I can create the ideal conditions for these amazing disability professionals to do their best work and sort of prime folks in other places like university administrators, public policy makers, state agency leaders, that is how I found the most amount of impact and change in sort of my immediate day-to-day career. And I find that really fulfilling, because even though at the heart of what I care about most are people with disabilities, their families, and our communities, by supporting professionals, it's been a very fulfilling and impactful pathway for me, because there's so much we need to do, and there's a lot of incredible talent out there.
That's somewhat related to the way I see things. I, practiced clinically in this field for over 20 years, and it was And it was a decision, it's something I really had to think about, to leave my clinical practice and do the work that I do now. But I know what I do now still has an impact on people's lives and the health and wellness of people. And it's actually in a broader, there's a broader reach now. So I kind of understand what you're saying. By supporting, the field and professionals, you can still make a difference and really have a very big impact.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So Kelly, we're going to do something called 3 and 3.
Okay.
So it's 3 things in 3 minutes or so. I'm not going to hold you to it.
Yes.
But 3 things that you would like people to know that you think can improve the world, improve health and wellness, improve supports and services for people with intellectual and developmental disabilities.
Yes. So the first one, I thought of first 2 right off the top of my head. The first is that people are people. And that just as where we started this conversation about the experiences that everyday humans have and their health, their emotional well-being, their spiritual connectedness, we are all human. Yes, and regardless of the labels that are given to us or that we inhabit, people are people first. And so when you go back to that humanity and that connection of like, you and I are the same, this person, we share a common bond as humans, it makes, for me, it much easier to do the work and find the connectivity, because when you start from the place of commonality rather than the place of difference, that can actually move the relationship or experience forward. And so I think that would be my first one, is that people are people, and that people with intellectual and developmental disabilities are the same as everyone else. And even though you and I have worked in this industry, obviously, for a long time, it's still not necessarily a common frame. So I would say that is a really important one. So
it's hugely important.
That would be my first one. The second one that I would say is, and this is a little worky related, but I would say the value of the direct support professional workforce. That we have public policy aspirations, we have public policy investments, we have infrastructure in our states that are driving towards and increasing equity, inclusion, belonging, all of those things. And yet, if we do not have a direct support professional workforce, our aspirations around inclusion and belonging and participation are not going to be able to come to fruition. And so, again, we talk about it all the time, but I see it every day in my work. I see it every day with individuals and families, is that people want and need the lives that are waiting for them. And some people do need supports to maybe facilitate that. And yet we've not found the right set of strategies and investment that actually truly lift up this particular part of the workforce.
You know, just to echo on that, we all need support in our lives. None of us are fully independent. And that's it. It's really just a matter of the level or the degree or the type of support that we need. And when we think about it that way, it might just reframe our things that we see that are important in life. And not only do we all need support, but the level of support that we need changes over time and certainly can change very quickly. Any of us could fall into at any moment into a category where we need lots more support.
Correct.
And we may be relying ourselves on people like direct support professionals and others to help us live our lives. So, having that perspective, I think really can be impactful in the way that we think about what we need to do as a society to support direct support professionals and help them to earn a living wage and to feel valued, because they're extremely important.
It is a professional industry that has long been sort of, I think, been invisible to the broader society and community. But at the end of the day, I mean, one of the things I think that is also really challenging is that direct support workers are among us all the time. So when you think about paraeducators, when you think about professionals that are working in long-term care, when you think about people who are working as job coaches, like they all share this sort of common connection, yet we call them and use different terms. And so sometimes I do think as community and society, we don't actually realize quite how much support we are all getting from this group of professionals. And so I think that will continue to be one of our greatest opportunities, but also one of our greatest challenges in having more meaningful inclusion and participation of people with IDD.
And if you want to know more about the direct support professional world, I had Joe Macbeth on, the director of the National Alliance for Direct Support Professionals, on, and you can go back and find that episode. But I'm not letting you off the hook.
Okay,
that was only two.
Yes.
You got one more.
And so the other one is a little bit more personal. And I think what I would share and reflect on sort of the years that I've worked on the field, the different types of professionals, is that the care and passion that we extend to the populations and communities we care about, we have to do for ourselves as well. Because I have certainly, witnessed and worked with, and even on my own personal level experienced, is that we have to take care of our own health, our own mental health, our own physical health, whether that's whatever that looks like for an individual. And I think the importance of self-care is really important, because at the end of the day, the work and the game that we have to move forward for this kind of policy, advocacy, and education, it's long. This is light. This
it's
is
not without its
lifetime
challenges,
work.
right?
Correct. And so we also have to invest in ourselves as professionals and as fellow humans, because I see so many people give and give and give and burn out and either leave the field or get frustrated. And so recognizing the importance of boundaries, healthcare and supportive care for yourself as an individual, for other professionals, I would also say is essential, because if we're going to continue to do this work, not only we have to care for ourselves as much as we want to care and support other people as well.
Couldn't agree more. Kelly, this has been delightful, enlightening, and really empowering. I think people out there will be empowered by this conversation. Thank you so much for taking the time to talk with me today, and I look forward to chatting more with you in the future.
Thank you so much, Craig. Have a great day.
You too.